Clay, West Virginia, is tucked into the remote, rolling hills of coal country. The nearest hospital is 50 miles away on these winding rural roads. And with a poverty rate approaching 30%, many here can barely afford to drive, let alone the care, like Carl and Elizabeth Walls.
If life and death depended on money, I'd just have to die.
You would be dead right now.
I'd been dead right now.
Carl had a massive heart attack a little more than a month ago. First, a long ambulance ride and blood thinners at a rural hospital. Then an emergency helicopter medevac to Charleston.
They treated me with respect, with dignity, with every direction that you could ask. And in spite of me not having any money, I was treated as if I were a king, you know.
Most of their life savings went to paying for back surgery and other health issues Elizabeth had a few years back. She has diabetes and is legally blind.
Why won't you go to the doctor?
Because I can't pay for them. And I could go and I get bills and I can't pay those bills, so.
Thousands and thousands of dollars worth of bills come in, and what can you do about it?
But so you'd rather not go to the doctor than to have a bill come that you can't pay?
Right.
We want to take a look at what the U.S. is spending right now on health care and how it compares to other countries, and are we getting our money's worth? Maybe that's another really important question to ask and answer here. Senior medical correspondent Elizabeth Cohen joins us now. Good to see you, Elizabeth. Walk us through this.
Tony, some of these numbers are really eye-opening when you look at how much money we spend here in the United States on medical care. So first, let's take a look at France and the United Kingdom. In France, they spend $3,449 per person per year on health care. All right, so that's this guy in France. That's what it's costing him to get health care every year. In the United Kingdom, they're spending $2,760 per year in health care. Okay, so you can see there's already a difference there. But now, let's move on to Canada and the United States. In Canada, they are spending, for every Canadian, they spend $3,678 per person per year on health care. In the United States, are you ready for this, Tony?
Yeah.
Are you ready? All right, we're talking like $2,000, $3,000 for the other countries. $6,714 per person on health care.
Really?
Really?
Can you come over here
yes.
and we can talk about this a little more?
Because you gotta wonder.
And as you do the walk here, I'm wondering, okay, so we're clearly spending more. Here, let me help you with this.
Oh, thank you, sir.
So we're clearly spending more. Are we getting our money's worth? Are we healthier?
Now, some people would say that Europeans and Canadians come to the United States for health care, right? I mean, they often come here when they can't get what they need in their own country, and certainly some of the most fabulous technology in the world is in the United States. But there are also some statistics that would say there's no way we're getting our money's worth. Let's take a look at this. Infant mortality, you would expect the United States, with all of our incredible resources, we would have the lowest infant mortality rate in the world. Not so. Infant mortality, we are 44th, meaning there are 43 other countries with lower infant mortality rates than ours. And when you look at life expectancy in general, overall, we're 50th. 49 countries have better life expectancies than we do.
So walk me through this here. Why are we spending so much more for health care than other countries?
When I talk to experts about this, this is what they say. They say in the United States we have a lot of administrative costs because there's so many different insurance plans, and as everyone agrees, it's a bit of a mess. But also that Americans tend to go to specialists more, and that also ends up costing a lot of money. And also, some people would say that in European countries and Canada, there's more of an emphasis on prevention. Let me just give you an example. A friend of mine who's British, after she had her baby, a public health nurse came to her house every day to check up on the baby and see how it was going.
You kidding me?
Yeah, that doesn't go on here. But that's great prevention. If anything
it goes
were going
on here.
wrong,
The nurse is knocking on your door for the check. You owe me. Sorry.
Well, or just not there at all.
Just not there at all.
If the baby's sick, you have to make that trip.